if you don't have an understanding of what your health data is, it's very difficult to also understand how safe it is. So your health data is your personal information, what you give in terms of name, where you stay at, your location. Then we go down to the nitty-gritties of what is ailing you, what diseases you have, your diagnosis, and that sort of information that you would likely leave with the hospital as you're getting treated.
We have the right to health protected under the Constitution under Article 43, and that one gives the overarching legal framework that allows for the use of digital health in Kenya to ensure that people are able to access health services.
Now we have a Data Protection Act that clearly defines health data as being sensitive personal data, which also provides for specific parameters for the processing of personal data for whatever purposes, and for this instance specifically health data.
There are some negatives, as there are with everything else. We have issues when it comes to how do you protect somebody's privacy and data in the digital technology space? How do you make sure that you limit bullying, harassment, and how do you make sure that this doesn't translate into physical harassment outside of the online space if things are said online and then it attracts violence offline?
We've had instances like Facebook or other entities selling data, right? When we actually go to a health center and then you're going there because of seeking healthcare service, how safe is your data? How safe even as simple as your weight?
Even the use of biometrics for the key population, we understand how that can implicate someone's life. When someone has your biometrics and you identify yourself as key population, you can be arrested because we are a criminalized community in the country.
So the worst that would happen if digital health and health data in Kenya is misused would be death specifically. And I'll give an example. You can imagine a high dependency unit like Kenyatta Hospital that has digitalized their operations to the point where you've got a piece of software that is being used to control how much medication is being given to a patient in HDU, right? So it's highly programmed, very precise. You can imagine what would go wrong if that was not done the right way or is not maintained in the right way. And the truth is we are not the best country in terms of maintenance, right? So the patient will die, right? Now if you extrapolate that at a public health level, then you've got lots of death happening.
Safety of health data goes very much into also understanding what is my health data, to what extent am I giving it out, and in that capacity also understanding with whatever organization, hospital, platform, website platform that I'm giving this information to, do they have specific ways in which they protect this information, and am I aware of them? Because in essence, it's supposed to be public. The information of how they protect your data is supposed to be publicly available.
So it is important that for us to achieve an enabling legal environment, we ensure that there is proper participation of everybody. There is a comprehensive audit on what is currently in place, and thirdly, that we now work towards now just having one legal or one law that specifically talks about digital health, and this being the e-health law.
So I would say we're doing well, but we're missing a couple of other things. Like for example, we don't have an investment framework for digital health in Kenya. So what that means is that when partners come to Kenya, they don't know exactly where to plug in terms of where their gaps are.
And for the existing frameworks that we already have in place, it's more of an implementation aspect. To what extent are they being implemented? Which stakeholders within the health sector are responsible for ensuring that these have been implemented? At the end of the day also, who will be held accountable when some of these things haven't been implemented, and what is the recourse to the lack of implementation of all of them and to the lack of compliance in that respect?